The first one I thought was really interesting is in the frontline setting. So there's an abstract presented from a combination of two phase 2 clinical trials that were done at Dana-Farber and Washington University in St. Louis, as well as some patients that were treated off clinical trial. And in that particular abstract, what the investigators were looking at was overall responses and progression-free survival and overall survival using an induction regimen of bendamustine rituximab given for 3 cycles. And the patients were having an appropriate clinical response. They went on to get 3 cycles of rituximab cytarabine before getting an autologous stem cell transplant. And I thought that abstract was particularly interesting because we don't really know what the optimal induction regimen is. We know that there are a lot of different induction regimens people use, and I think what this trial presents is another, I would say, modern option to think about that needs to be studied in additional randomized prospective studies, but really provides some compelling evidence that combining bendamustine and cytarabine may be a good way or maybe a good platform prior to autologous transplant.